Welcome to this month's edition of Focus on Health. I'm Dr. Jacqueline Duche, the Deputy Health Officer for the Frederick County Health Department, and today I'm interviewing Dr. Barbara Brookmeyer. She's the lead for the Local Health Improvement Plan, and she's going to share with us today information about the Local Health Improvement Plan. And I'd like to welcome Dr. Barbara Brookmeyer to this month's edition of Focus on Health.
Well, thank you for having me and interviewing me. It's great to be on this side of the interview chair.
All right, so if you could talk to us a little bit about what the Local Health Improvement Plan is.
Well, the Local Health Improvement Plan, it is a document. It's a document that provides a framework for consensus-based recommendations for improving the health of our community here in Frederick County. It's sort of, maybe it's easier for people to understand if we describe it more as a roadmap. So it's a roadmap that says this is where we want to be, this is where we want to get to or go to in terms of health improvement, health, well-being, and these are sort of the strategies for how we might want to get there. And it also comes out of a recognition that the healthier our community is, the healthier our economy will be.
So can you talk to us a little bit about who was involved in developing the Local Health Improvement Plan?
Yeah, so the plan actually is part of a larger process, a health improvement process that began back in about 2006 with the Frederick County Healthcare Coalition. And the Healthcare Coalition, in partnership with the Frederick County Health Department and the Frederick Regional Health System, worked on first identifying or assessing what the health status is and was in Frederick County. Back in 2007, the coalition published a community health assessment. And so the coalition began first with saying, so what information do we have that talks about what is our health status so that we can get a better idea of, well, what are the needs and what might we want to work on, and then also be able to use that as a benchmark for when we do implement some strategies. You know, how well have we done? So the Local Health Improvement Plan is really part of a larger process that has been underway for many years now. So
you talked about using the prior information from 2007. So based on the development of the Local Health Improvement Plan, what health priorities have you all working towards?
Well, it was really exciting. Back in October of 2011, we convened a summit, and it was attended by over 80 persons from a variety of stakeholder interests in the community. And during that meeting, we reviewed current data, so updated that 2007 health needs assessment data, and looked at, so what's the current health status for health, well-being, looking at a variety of indicators. Then the participants had discussions about what the data indicates to them, where there might be opportunities for health improvement. And then finally, the attendees actually voted that day on what are the priorities for local health improvement in Frederick County. Not priorities that are relevant to the state, not priorities relevant to the nation, but actually priorities that are relevant to Frederick County residents.
All right, that's very good. Now, can you give examples of some of the things that are being done to actually make it a living document? Actually, people can work through the priorities.
Yes, I'm so glad you brought that up, because it's not, sometimes people think of a document, oh, it's just something that collects dust on a shelf. And we actually aren't even using the document itself much, and having it available electronically is helpful. But there's a key part that all the work groups continue to use out of that Local Health Improvement Plan, and that's the action plan. So for each of the priorities, oh, and I should probably mention what those priorities are. The priorities, and they're really listed as very broad statements because there's a lot that goes under them, and I can talk a little bit more about that. But the first priority was mental health, then affordable dental care, especially looking at adults, but affordable dental care, wellness and prevention, access to care, health inequities, and then early childhood growth and development. So work groups focused on each of those priority areas, then developed what the goals were, multiple goals under each of those priorities, and then in some cases multiple objectives under each of those goals. But the really key part is the action plan, or the strategies to try to make a difference and improve the data that we have through a variety of collaborative partnerships throughout the community. And what's been so exciting is the growth of each of those work groups. So we're over a year into the work groups being in existence, and daily, but it's probably not too much of an over-exaggeration to say daily we're bringing on new partners in the work groups to add additional perspective, additional expertise and interests in moving the needle in terms of health improvement here in Frederick County.
So it sounds, it sounds like there's great work that's been done to date. And moving forward, how would you recommend people continue to learn more about the plan and how they can they possibly help?
Yes. While in this first year, some of the action plans have been implemented and completed, I'd say most of them are ongoing. And there's an opportunity for persons who have an interest in any of those 6 priority areas to be involved. So say, and before I forget to mention it, so we have a website set up, and that provides additional information, and people can contact me anytime. But it's www.frederickcounty.md.gov/LHIP for Local Health Improvement Process or Local Health Improvement Plan. But so say under the mental health priority, there are folks who are involved in helping to reduce stigma associated with mental health issues. Folks involved in providing education to the general public as well as to primary care providers about some simple screens, some interventions, and some useful and beneficial and evidence-based approaches to try to reduce the number of people who have untreated mental health issues or who choose suicide. The Affordable Dental Work Group, they're continuing to pursue an oral health literacy campaign, and so that's a term that is really about improving oral health awareness and education among everyone in the community. And they're working towards opening up a dental clinic in partnership with the University of Maryland and Frederick Regional Health System, and many others. Local dentists in the community have expressed some interest in assisting with that effort. So that's also a very exciting opportunity. There are also other charitable organizations in the community that are joining the work group and participating in trying to make that a reality. Let's see, so wellness and prevention, there's a lot of activity going on about workplace wellness, supporting local businesses in improving wellness in the workplace. There are also efforts for improving the nutrition and physical activity of both adults and children, a variety of things related to the parks, related to what goes on in the grocery stores and options and awareness, making healthier choices. A lot of it is focused on healthier choices, as well as reduction of smoking in adults, especially pregnant women. I could go on and on with the other groups as well. The early childhood growth and development is addressing issues of safe sleep practices. Also a lot about the wellness, the health and nutrition and activity levels of children. And the Access to Care group is working on making sure that folks are aware of resources that are available for them to be able to access care, and they're always looking for more folks to help them out. One, to be informed and spread the current information about healthcare reform, but also to find ways to help people who aren't yet connected with systems of care to be able to get connected to those. And then health inequities are to be addressed in each of the 5 work group areas that I mentioned. So really there's probably something for everyone, and if someone's not sure, they can just give me a call and I'll help them identify what work group might provide opportunities that are of interest to them.
Well, it sounds like a great opportunity for the community to get involved to improve the health of the community. And I'd like to thank you again for coming out to speak with us today.
You're welcome. I'm very pleased to be here, and thank you for making the time for us to be able to talk about the Local Health Improvement Plan. And now please stay tuned for this month's Medical Myth.
Hi, Hi, I'm Corporal Jennifer Bailey, spokesperson for the Frederick County Sheriff's Office. The Sheriff's Office and Frederick County Public Schools have partnered with Xerox in its Cross-Safe program to provide a new layer of safety for students. Under the new program, school buses will be outfitted with cameras that will monitor and record motorists who illegally pass buses while they're stopped. The video will be provided to the Sheriff's Office for verification purposes, and a $125 civil citation will be mailed to the registered owner of any vehicle found in violation. Frederick County is the first in Maryland to install enforcement systems on school buses. The program will allow bus drivers to focus on the safety of students and make bus routes safer overall. Motorists can do their part by being on the lookout for children who may cross the road without looking for traffic. Being prepared to stop and remaining stopped for morning pickups and afternoon drop-offs is always a good defensive driving strategy, and Maryland law requires vehicles to be at least 20 feet away from the front or rear of a stopped school bus. By obeying all traffic laws, motorists will help to ensure the continued safety of Frederick County students.
The Frederick County Division of Utilities and Solid Waste Management has an important message for the holiday cooking season. Don't ruin your holiday by pouring fats, oils, and grease down your drain and causing a sewer backup. Never pour kitchen grease or oils down the drain, because fats, oils, and grease can clog sewer pipes, leading to basement backups and sewer overflows that can damage a home, business, and the environment. The best way to dispose of these items is to pour cooled grease into a can, such as a soup can, and dispose of it into the trash once it has solidified. For further information regarding proper disposal of grease, contact the Department of Regulatory Compliance at 301-600-1825 or visit www.frederickcountymd.gov/grease.
Through a new Frederick County program called Power Saver Retrofits, you could receive up to $1,600 worth of energy efficiency improvements from a professional contractor for a cost share of just $400. First come, first served, limited time offer. Funded projects include air sealing, insulation, duct sealing, caulking, weather stripping, light bulb upgrades, and more. Qualifying homes are located in Frederick County, free of unvented combustion appliances, and 2,600 square feet or less of conditioned space. Visit www.frederickcountymd.gov/greenhomes or call 301-600-1306 to get an application or learn more.
And now here's this month's Medical Myths. This month's Medical Myths is about strokes. The first myth is that stroke is unpreventable. The reality is that stroke is largely preventable by stopping smoking, controlling high blood pressure, maintaining a healthy weight, and getting exercise, along with treating diabetes, treating heart disease, and reducing stress. The second myth is that a stroke cannot be treated. That is a deadly myth. The reality is that stroke requires emergency treatment. Another related myth is that people think that they should wait and see if it goes away, or wait until the next morning to seek medical attention. That could be a deadly myth. The effectiveness of stroke treatment lessens as time passes. Ideally, treatment would begin within the first 3 hours and definitely within the first 8 hours of symptoms starting. The final myth for today is that strokes only strike the elderly. The reality is that a stroke can happen to anyone. This misconception can lead to a delay in diagnosis and treatment, which can have devastating, even deadly consequences. The truth is, people of all ages have strokes. If you have any of the following symptoms, you should act fast. Those symptoms include a facial droop and an uneven smile, arm numbness and arm weakness, slurred speech, difficulty speaking or understanding. Minutes count. Treatments that may reduce the damage of a stroke are available, but only if help is sought out quickly within 3 hours from the time the person is last known or seen to be well. Time is critical when you or someone you know is having a stroke. Remember, call 911 if you think you're having a stroke. That's this month's Medical Myths. And now here's Angie Blair with this month's health tip.
Hello, this is Angie Blair, health educator with the Frederick County Health Department. This month's health tip is brought to you by the HIV testing and treatment program of the Community Health Services Division. On December 1st each year, World AIDS Day is observed as a day to reflect on the impact of the AIDS epidemic around the world and in our own local community. The epidemic is now 31 years old, and the number of individuals living with HIV, the virus that causes AIDS, continues to grow in the United States by more than 56,000 new cases each year. Some areas of the country are harder hit than others, and unfortunately, Maryland is one of the most affected states in the country, ranking in the top 3 states nationally for rates of HIV and AIDS. Even more alarming is the fact that 1 in 5 individuals living with HIV doesn't know they have the virus because they have never been tested. These individuals are much more likely to develop life-threatening conditions and are much more likely to transmit HIV infection to their intimate partners. Testing is key to early diagnosis, to achieving better medical outcomes for people who are infected, and to stop the growth of the HIV/AIDS epidemic. In 2006, the Centers for Disease Control and Prevention recommended that HIV testing be offered routinely in all clinical settings for individuals ages 13 to 64. This year, the U.S. Preventative Services Task Force is expected to recommend that HIV testing become a standard part of routine care for all patients. In addition, as part of the Act Against AIDS campaign, the Centers for Disease Control and Prevention is promoting a new slogan, HIV Testing Standard of Care, which is aimed at reaching both patients and medical practitioners. December's observance of World AIDS Day is a perfect time to ask your doctor for HIV screening. Free HIV testing is also offered at the Frederick County Health Department on Mondays by appointment and Fridays by appointment or walk-in between the hours of 9 to 10:30 a.m. and 1:30 to 3 o'clock p.m. Testing is strictly confidential, and results are provided within about 20 minutes using either the Clearview Complete or the OraQuick Advanced Rapid HIV tests. It's as simple as giving just a drop of blood or an oral swab. For appointments, the number to call is 301-600-3342. The Health Department also offers medical treatment for HIV infection. If you are living with HIV and are not in treatment for your infection, please call the HIV Services Program. Thank you for tuning in to this month's Health Tip.
And thank you for joining us for this month's edition of Focus on Health. Please join us next month.